Good morning, Bespoke Babes. It's Dr. Kim. All this week, we are talking about eyes and upper face. Of course, with COVID, we're all wearing our mask, which is covering our lower face, lips, lower jaw. So it's drawing a lot of attention to the eye area, the brow area, and the forehead. Yesterday, I talked to you about all the places we can put filler in the upper face, including into the crow's feet, the tear trough, the bunny lines, the number 11s in the glabella, a little bit under the brow for a brow lift, and the temporal fossa right here on the side of the face. Today I want to focus on eyelids and brows. So as we age, I've said this before, as we age, we're losing collagen out of our skin. And when we lose collagen, the skin becomes thin and not as structured, and it starts to droop and fall. And that's just part of the natural aging process. And that can lead to excess skin in the upper lid. You'll notice it as you start to have difficulty putting your mascara or eye makeup on. And it also leads to descent of or dropping of the brow itself. So we can get extra upper lid skin from two areas. One is the eyelid itself, and two is the brow, because you can see as I push my brow down how that adds to skin in the upper eyelid area. So if we're going to totally rejuvenate that area, we need to assess and determine how much of that is brow skin, how much of that is eyelid skin. So if we are doing eyelids only, we have several options. So one is our laser blepharoplasty. Lasers stimulate collagen production by basically creating a very controlled micro injury to the skin, stimulating collagen production. And as we stimulate collagen production, we smooth out the skin and give some structure and snappiness back to tighten it up. And that is our Fotona smooth eye procedure. We're smoothing and tightening the skin. It is done as a series of treatments, usually 3 to 4 treatments. Each one takes 45 minutes or so. Your skin is a little pinky red afterwards, feels a little bit like a sunburn, and then it flakes and peels away over a couple of days. We do this spread out by 3 to 4 weeks. So we're stimulating collagen, stimulating to really get that smooth and tighten. Important in the summertime, if we're lasering, you have to be so careful about your sun protection, because if you burn or tan freshly lasered skin, it's going to get discolored. So we have to be very careful with the smooth eye procedure in the summertime. But basically we can go all the way along the upper lid, the crow's feet, and into the lower lids itself. And actually the last one I did, it came right up over the brows as well to give that full lift. It's going to last 18 months, 2 years or so, but very minimal downtime with that. The next option for the upper lid is to do surgery. If we're going to do a surgical intervention, we need to determine whether we're just doing eyelids or whether we're doing brow as well. A surgical blepharoplasty is pretty straightforward. We do it just under a local anesthetic. We cut away that extra flap of upper lid skin and a little bit of the fat just in the corner there. Stitches in for approximately 1 week's time. You do bruise and swell from it, so you have to be prepared for that for a little bit of downtime. Once the stitches come out, you can put a little bit of makeup over the incision, and it tends to heal quite nicely. It's in that crease in the upper lid, so once it settles, it's fairly subtle and it can last for many years because we're actually taking the skin and fat away. Sometimes we combine our surgical upper lid blepharoplasty with a brow lift, and that can be done surgically, which involves making incisions up in the hairline, coming down this way to pull things up. That's a little bit more invasive, and there's a little bit more downtime that goes with that sort of dissection. We can combine surgical upper lid with some filler underneath the lateral corner of the brow to give that brow lift. And we can combine it or just do a brow lift on its own with our Bella brow. Our Bella brow is a procedure just done under local, and we can focus, it's basically an injectable that we can focus on either the lateral aspect or the entire brow to lift it up. If we're focusing laterally, we can give you that really cat eye, that Bella Hadid cat eye lift, and it's gonna last approximately 18 months to 2 years again, but very, very minimal downtime, minimally invasive with that Bella brow. So those are our upper lid brow options. As always, if you have any questions, you can send us a message, post it, or email. And that is it for today, Bespoke Babes. Keep those masks on, keep those eyes open, and can't wait to see you in clinic.